Hello, my name is Virk, and I am here today to apply for a nurse practitioner position. I have brought along with me a CV, a copy of my resume, and a copy of my certifications that I am providing to you. Please find attached. So, I have worked as a psychiatric mental health nurse starting from the period of February of 2017 all the way till now. Currently working at Green Oaks Hospital, which is a branch of Dallas Medical City. I have worked for Garland Behavior Hospital. I did a travel assignment for 4 months for Flex Care staffing. I've also worked as an agency nurse, which actually introduced me to healthcare. Um, as a me- I've also worked for Texoma Medical Center as a medical surgical nurse. And that's basically where I started my career at Texoma Medical Center. I learned how to I learned IV therapy, dialysis, taking care of a patient on dialysis, taking care of a patient with a body fluid deficit. As a mental health nurse, I learned how to verbally de-escalate a physically aggressive patient. I got SAMA certified. I have a BLS certification. And I also, because of the nature of working as a medical surgical nurse, I also needed a stroke scale certification, which was provided by the National Institute of Health. And my job as a psychiatric nurse included doing admissions, discharges, assessing the patient physically, but mentally as well, and to do reconciliations, um, refer patients over to different doctors, or make the referrals for ready for the psychiatrist to refer those patients over to the doctors. My job as a psych nurse also included doing a psychosocial and emotional assessment on a patient and the patient's family as well, to utilize critical thinking in planning and prioritizing nursing care, developing treatment plans for these patients, and providing the right resources and encouraging my patient to follow the educational programs. I graduated in March of 2000. I'm sorry. I got my nursing license in March of 2016 and have not looked back since. I have done several different types of jobs, which have given and worked at several different types of hospital facilities, standalone mental health units, hospital mental health units, and a 300 Texoma Medical Center was a 380-bed hospital that I worked as medical surgical nurse. I worked on a floor that was a renal GIGU, but also a overflow floor. So we had patients who had cardiac catheterizations. We had patients who would come in for ECT. Excuse me. We also had patients who would come down from the ortho floor, or they were stepping down from CCU. So this gave me a variety of experience on how to take care of a patient who might be having a heart attack, or having a stroke, or having respiratory distress. The psychiatric part helped me take care of patients who had bipolar disorder, schizophrenia, along with the medical health issues that they were having as well. I worked as a pharmacy technician from January of 2006 all the way to April of 2013, at which point I quit working to pursue my career in nursing. I worked for Prime Therapeutics, which is a mail order pharmacy and also an insurance company, and I worked as an insurance representative, completing prior authorizations that would come in from physicians, nurses, and other medical staff for their patients. I provided education to the customers about what was medically necessary and what their doctors needed to provide in order for the insurance to pay for this medication. I also worked as a lead pharmacy technician for Walmart. It was a retail position. This retail position helped me build endurance and a relationship with my patients, where I had a servant heart, and I was serving these patients and guiding them, providing them the right route to on how to take their medications, on how where to get references from, where to get education from. This career, the pharmacy technician career, also helped me NP. I had a foundation where I knew the classification of drugs, I knew their side effects, I knew what they were prescribed for, and I knew what to look for, what signs and symptoms to look for in a patient who might have an overdose or have an intoxication or allergic reaction. I completed my education, my master's in science, with a specialty as a family nurse practitioner from United States University, which is based out of San Diego, California, which is also a branch of the Aspen Colleges in Colorado. I started in October of 2017. The program finished in December of 2019. I did my Bachelor's of Science in Nursing from West Coast University, which is a very well recognized university in California. They have a branch here in Dallas where I finished my school. I started in April of 2013 and finished it in January of 2016, upon which in March I received my license. I learned many skills over the period of my health career, which started in 2006 and going 2019. It will be 13 years in healthcare, providing healthcare to patients and guiding them and teaching them what I know so that they can take better care of their health. Um, done medication administration. I'm very familiar with medical terminology, Meditech. My clinical instructor my preceptor has been the most wonderful instructor a student can have. She has let me had hands-on experience with the charting system, with how to deal with a angry aggressive patient, how to take care of an emergency situation, what the nurse practitioner is expected to do, when the nurse practitioner is supposed to put in a referral, what binds the nurse practitioner, which laws she needs to respect, how she needs to stay in her boundary as a nurse practitioner and practice that way. I volunteer at the Salvation Army during the holidays. Uh, my clinical experience was with Cornerstone House Calls, which provide urgent care, family medicine, geriatrics. I did clinical work at Medical City Plano at the Gynecology and Obstetrics Department, Baylor White Rock Hospital Medical Surgical, Cook's Children Hospital Pediatrics, and Agape Clinic, where they have family medicine, pediatrics, geriatrics, and women's health. This was during my MSN program, clinical, and during my BSN program. It's a combination. Most of my MSN I did with Cornerstone House Calls because that's where my preceptor worked, and we saw all patients of all age groups, and we took care of them whether they were at home or whether they came to the clinic.